Good morning, everyone. Hope all of you are doing good. We are going to discuss a topic called therapeutic cloning. If you see the syllabus of 202, the last unit, one of the topic which is given there is therapeutic cloning. What is therapeutic cloning? Already I told you about the therapeutic cloning under transgenic stem cell. Therapeutic cloning is a process of cloning technique wherein we are using the cells for treating the disease. That is why it is called as the therapeutic clone. Transgenic stem cell is also similar. We are inserting a foreign DNA into the stem cell and using that stem cell for treating some of the disorders. Okay, so it's more or less same, or you can say it is exactly same only, but two different topics are given. So whatever is asked, you have to write the same thing only because both are similar. Okay. So now I will explain it once again, the therapeutic cloning process. This already I told you under transgenic stem cell. We discussed about the somatic cell nuclear transfer and the differentiation of the embryonic stem cell, all those things we discussed. And I've given you homework also. All of you have done the homework. And I am sure that you are thorough with the topic. Okay, but I'll tell you what all things you need to write under therapeutic cloning. Okay, so we'll take a patient. Okay, so this is a patient who is having a genetic disorder. What example we'll take the example of hemophilia A. What is hemophilia A? It's a bleeding disorder wherein there will be deficiency or defect in the factor 8. Factor 8 is one of the factor which is needed for the blood clot formation. So whenever you have a bleeding, the platelets will aggregate, and once after the aggregation of the platelet, some of the factors are needed for the formation of a proper blood clot. So whenever those factors are defective, those people will be suffering from a bleeding disorder. So hemophilia A is one of the bleeding disorder wherein there will be defect in factor 8. Okay, fine. Now, for treating this disease from this patient, so you can see here he is looking very sad because he has the genetic disorder. You need to take out his somatic cell. You can take his skin cell or from cells from the hair follicle. Any somatic cell can be taken out. Okay, so this is his somatic cell. Now once after taking the somatic cell, what you need to do? You have to go for a process called as the enucleation. After the enucleation, you separate the nucleus. So this is the nucleus what we need, and discard the cell. After removing the nucleus, this is the nucleus. The remaining part you need to discard it. So this nucleus is ready. So once the nucleus is ready, you are going to insert this nucleus into an enucleated egg. Okay, so for that purpose you need egg. Donor's egg is needed. Okay, so we'll take a donor's egg. I'll make it here. This is the egg. Okay, so if this patient, if he's a male, you can ask your his wife or mother or any of the relatives to donate one egg. Okay, so the egg, after taking the egg, what is the next step? Enucleation of the egg. We don't want the nucleus. Nucleus is removed. Okay, into the enucleated egg. This is the enucleated egg. What is the purpose you are doing? You are implanting the somatic cell nucleus. Implanting somatic cell nucleus. So you are inserting the nucleus into the enucleated egg. Fine. Now your egg is ready. You have to take this egg, and what is given? One injection is given, you remember? What is that injection? Phospholipase C zeta. So that injection will be given to the enucleated egg. So with the micro needle, they will inject phospholipase C zeta into the egg, modified egg. This is a modified egg. Now what happens is this one, after giving the PLC zeta injection, they undergo differentiation, and within 3 to 4 days of time period, blastocyst stage will be developed. Okay, this is the blastocyst. In inner cell mass of the blastocyst, what is it called as? Embryonic stem cell. Fine, now your embryonic stem cell is ready for your treatment. Okay, so this is how we do. And now you tell me, nobody asked me also what is the purpose of injecting this PLC zeta. What is PLC zeta, phospholipase C zeta? Usually during the fertilization process, for the oocyte activation to happen, okay, oocyte activation is one of the major event in fertilization. That is initiated by the sperm. It has the phospholipase zeta. Okay, phospholipase zeta is needed for the oocyte activation. Oocyte activation in the sense for the differentiation purpose, it needs this phospholipase zeta. Okay, the fertilization event will be initiated by the release of phospholipase zeta by the sperm, and calcium ossification happens. Have you heard of calcium ossification? What do you mean by ossification? Ossification in the sense movement back and forth in a rhythm. Oscillation means movement. The clock, the pendulum will be moving in an oscillation way. What do you mean by oscillation? Movement back and forth in a rhythm. Okay, calcium. Where is the calcium stored? Calcium is stored in the endoplasmic reticulum. Smooth endoplasmic reticulum is the calcium store. So whenever the fertilization is happening, there is a need for calcium. Calcium release or calcium ossification is activated by the PLC zeta. Usually this will be there in the sperm head, and the calcium is needed for the differentiation. So we are not inducing the fertilization here. Instead of that, we are giving PLC zeta injection. So as soon as you give this PLC zeta injection, this is like a cheating process. We are cheating the egg. The cell will think that fertilization has happened, and it will start the differentiation process happens. So earlier days, when this facility was not available, they used to, once after introducing the nucleus of the somatic cell into the egg, they used to do in vitro fertilization, and then keep it in the incubator for the blastocyst formation, and then they used to separate the embryonic stem cell. Now all those problems are overcome by injecting the PLC zeta into the the modified egg. So the differentiation happens and blastocyst will be formed, and the embryonic stem cells can be isolated, and you can culture the embryonic stem cell. And when you, after culturing the embryonic stem cell, what is missing here? Factor 8 is missing. That gene can be introduced into the embryonic stem cell. Okay, so factor 8, that gene can be introduced, and culture this embryonic stem cell for enrichment. Okay, that means they'll be stabilized after injecting the factor 8. When they are enriched, when they are properly formed, the stem cells which are formed here, okay, the stem cells which are proper, or which are with the factor 8, that can be injected back into the patient. Okay, so once after injecting, he will be cured from disease, and the patient becomes happy. Okay, so this will be injected back, and after 2 to 3 months of time period, he will be cured from the disease. Okay, this is called as the therapeutic cloning. Same thing we discussed under transgenic stem cell also. So what are the steps involved in therapeutic cloning? Therapeutic cloning is a process, completely depend on a process called as, what is that process? SCNT. What is SCNT? Somatic cell nuclear transfer. Why it is called as somatic cell nuclear transfer? We are taking out the somatic cell, removing the nucleus, putting the nucleus into the enucleated egg. So that is why the technique is known as somatic cell nuclear transfer. Okay, enucleation of the egg, then enucleation of the somatic cell. From whom? From the patient who requires a modified gene. Okay, the nucleus from the somatic cell is inserted into the egg, which had its nucleus previously removed, and the egg now contain patient's genetic material. Okay, so now the egg is having the patient's genetic material, so there is no need of any like a transplant rejection. Usually when people go for transplantation, there is a rejection chance is there. So we can overcome that rejection process by using this SCNT method, because the egg is having the genetic material of the patient. Now they will stimulate the egg to divide and reach to blastocyst stage. The cells of the inner blastocyst mass are isolated, and it is utilized to create embryonic stem cell, which are modified and infused into the patient, where they integrate into the tissues and the genetic defect will be cured. Now, what are the advantages of this particular therapeutic cloning method? This procedure, it will save the life. Okay, so usually people they will have to wait for a long time for the stem cell transplantation process, because usually earlier days they used to wait for the donor. They used to isolate the stem cell and implant into the patient. A proper like a non-defective stem cell they used to implant into the patient. So nowadays, because of this particular technique, there is no need of waiting for a longer time. Okay, embryonic stem cells are pluripotent in nature, therefore it can be used to replace dysfunctional cells, and this method avoid the immunological rejection of the organ. I told you why it will be preventing the immunological rejection, because the genome is from the patient itself. Okay, because patient's own genetic material is used, and reduce the wait period for the organ transplantation, and there is no need of another individual experiencing the pain. So isolation of a stem cell, they used to use a bone marrow transplantation process. For that, bone marrow transplantation is a very severe painful condition. So this particular process, if we are using, we can overcome that. Therefore, another individual or the donor would not have to experience the pain. What are the problems associated with it? Okay, so now the major problem is we need to do many attempts. Every first time when you are doing, it may not be successful, so you have to do many attempts to create one viable egg. And the stability of the egg after inserting the somatic cell nucleus is very poor. Sometimes after inserting the somatic cell nucleus into the egg, the stability of the egg is a question mark. That is another drawback. First one is we need to do many attempts. Second one is the stability of the egg after the enucleation, after implanting the nucleus, somatic cell nucleus, it is poor. And nowadays it's not a problem. Earlier days there was a major issue, because when you do, I told you that nowadays they are injecting the PLC zeta to activate the differentiation of the egg. Without even fertilization, the cell will undergo division, and the embryonic stem cell will be formed. Earlier days, when this method was not available, they used to induce an in vitro fertilization, and then embryo used to form. When it reaches to the blastocyst, they used to take out the embryonic stem cell. Problem with that was, it was a complete destruction of an embryo, or killing a life, right? If you, after the fertilization, if you leave it in the incubator and then implant into the uterus, this one will develop into a human being. So the ethical issues were there, wherein they used to say that this is like a killing a life, or destructing one life, because when you remove the embryonic stem cell, it cannot survive further. So the destruction of embryo, and therefore raised many moral and ethical issues. That means if embryo could potentially to be a human being, destruction of an embryo, that was killing a human being. So there were many ethical issues, but now that ethical issues are not there, because we are using this particular method to activate the division of the egg. We are not inducing the fertilization. If fertilization happens, then only it can develop into a human being, but we are not inducing the fertilization. Instead of that, we are using injection. We are giving an enzyme PLC zeta. What is the function of PLC zeta? This always you have to remember when you go for interviews and all, they will ask. This is the enzyme which is needed for the calcium ossification. Calcium is needed for the differentiation of this cell. So what do you mean by calcium ossification? Removal of calcium from the endoplasmic reticulum, and sending this calcium back into the endoplasmic reticulum. It's a rhythmic process, wherein the movement will be happening in a rhythmic way. So this process is called as the therapeutic cloning. Please go through that. Any doubts, you can ask me.